On to our first topic. What happens to conservatism? The idea was that the Tories would charge you less than the other guys. Boris Johnson signed a pledge, one of his 6 pledges, not to raise taxes.
Read my lips, we will not be raising taxes on income or VAT or national insurance. On the contrary, what we are doing...
For the lifetime of that government.
For the lifetime of the Parliament.
That pledge didn't last 2 years. And he's saying he's raising taxes to pay for the NHS. Realistically, it's for a new social care settlement to make clear that nobody will have to sell their house, in his words, to pay for their social care. So what's happening? Are we seeing a big shift to big state conservatism? Kate Andrews joins me now. So Kate, let's go through the economics here. Historically, this is quite a big tax rise, isn't it?
It is, Fraser. According to the Institute for Fiscal Studies, the tax burden is now at its highest ever sustained level. Let's talk it through. This week, the government announced its plans to fund its efforts to catch up on the NHS backlog created by COVID-19 and reforms to social care. It's going to do so by raising taxes. From April 2022, national insurance is going up by 1.25 percentage points for employees and employers. So in total, it's a 2.5 percentage point hike. From 2023, it becomes its own tax, a new health and social care levy set at the same amount. The dividend tax rate is also going up too by 1.25 percentage points. It's projected this will raise an additional £12 billion for the Treasury's coffers. If you combine this with the tax rise from the March budget, which froze the personal allowance threshold and announced a corporation tax hike, Boris Johnson has achieved record levels of peacetime spending. Since these funds are mainly being sourced through national insurance, it's people in work who will be contributing most. So how might that affect you? Well, if you're earning £30,000 a year, you'll be paying roughly an additional £250 a year. So we're talking about hundreds of pounds transferring from the earner to the taxman. What do you get for it? Well, a promise has been made to increase NHS capacity from 110% at its current levels and to deliver 30% more elective procedures by 2024-25 than were previously available before the pandemic hit. These clear targets will make it easier to assess if the government has delivered on its word. But of course, there's no guarantee that it will. The NHS had a problem with waiting lists long before the pandemic hit, as trusts often failed to reach waiting time targets, keeping people in pain who are waiting for care. So we wait and see. As for social care, the assets of the middle class are now better protected. A lifetime cap of £86,000 has been set for what a person will contribute to the cost of their own social care, making it far less likely that somebody might have to sell their home to pay for care. The taxpayer, instead, will pick up the bill. Meanwhile, more support will be given to those who have assets between £23,000 and £100,000. They'll be eligible for mean-tested social care funding for the first time. Now, there remain outstanding questions as to how this money will be allocated. The government is instituting a legally hypothecated levy, meaning that the money will be ring-fenced by law for health and social care. But that's not irreversible with a big enough vote in Parliament. History goes to show that hypothecated taxes, and that's a specific tax to fund a specific purpose, rarely work. They tend to bloat the state, but the government likes to be able to prioritize funds as it sees fit, and usually finds a way of working around that. There are also questions about how much money is actually going to social care. The deal struck is that the NHS gets the bulk of the cash for the first few years to address the COVID backlog. Can anybody really see a scenario, though, where health chiefs are happy to hand it back? Or where the politics doesn't morph into accusations of cutting the NHS budget? The Resolution Foundation highlighted this week that despite the usual campaign cries, healthcare spending is not insignificant. It currently totals 40% of core day-to-day spending, and that doesn't include emergency pandemic spending. Still, it's difficult to see this money being rolled back, so already questions are being asked about where more money might come from. The government will have this new levy. Might they up it? Even with the tax burden at a near 70-year high, are things only set to worsen? Tough questions for a Conservative government. Back to you, Fraser.
Kate, thanks very much. So how is this debate going down in the Conservative Party? I'm joined now by Andrea Leadsom, who once stood for leadership of the Conservative Party. She's backing these proposals now. Andrea, thanks for coming on, but first of all, can you say a little bit about why you're confident that this will in any way fix social care? Because as far as what we've been told so far, it doesn't seem as if social care is going to be reformed in any way. It just seems that a massive big cheque has been written to the NHS with no real sign that it will get anywhere near social care.
Well, I think millions of people are going to be totally relieved that the government is gripping this issue of social care that's been ducked for so many decades. But in direct answer to your question, it is going to be a hypothecated new tax, the Health and Social Care Levy, and the government will be legislating to ensure that money is going to fix the social care system in two areas. One is to improve the domiciliary care, and the other is to improve the care home experience so that people don't have to lose all of their assets to pay for their care.
And the Prime Minister said yesterday that his plan was progressive. What did he mean by progressive? In what way is this progressive? Isn't this the poor subsidising the rich?
Absolutely not. No. Essentially, it's a 1.25% new national insurance levy. For those under about 9,500, they won't pay anything. For those under 21, for apprentices under 25, for veterans from the armed forces, there won't be any national insurance contributions for them. And then for everybody else, it will be progressive. So if you're a basic rate taxpayer, it'll amount to about £3.50 a week. If you're a higher rate taxpayer, it'll be about £17.50 a week. And then if you are a more wealthy individual, the top 14% will be paying around about 50% of the cost of this levy.
Right. But say, for example, you're a worker in a care home on the national living wage of about, I think it's just £9.80 an hour. I saw some figures from Policy and Practice saying that care home worker will be paying an extra £100 a year in tax for a fund that is available to millionaires. In what way is that progressive? In what way is that conservative?
Well, I don't think that the real beneficiaries are going to be, as you say, the millionaires versus the poor who will be paying for it.
But why not? You often said that you often put a cap on this. You could very easily have said that people who are millionaires won't benefit from this. They should pay for their own care. But rather than this, it seems to me quite explicitly, you're saying that the object of this is to relieve people, no matter how rich, from the fear of having to sell their own home. Now, that explicitly means that you will be giving money to people with big estates. A quarter of pensioners in Britain have got assets of £1 million or more in household assets. I think the majority of pensioners have got assets of £500,000 and more. These are households that, thanks to the asset boom, are very well off. And yet the Tory party is asking minimum wage workers to come up with a fund that can be used by them.
So it is a fund that will be used by everybody, and you're absolutely right, it is intending to cap the contribution of every individual to their own care. But you know as well as I do, Fraser, that at the very top end, people are not dependent on the social care system. They are looking after themselves, as is the case at the top end. Where this will really benefit is those with a modest property, perhaps in the region of £200,000 worth of equity in their home, that will protect them from having to sell all of their assets that they want to pass on to their children, or indeed risking that they end up with nothing left in order to pay for their own care. So where it really, really benefits people is those who are in that middle income, who at the moment, if you've saved nothing, if you have nothing, then you are in effect getting exactly the same as somebody who's saved and done the right thing and who is absolutely terrified about losing all of their assets. But a really important point here also to say is that the social care system is absolutely broken, and it has been for decades. Successive governments haven't gripped this issue, and what the Conservatives are now trying to do is to once and for all set in stone a system that actually will transform this so that everybody can benefit from it, whether they're elderly and with modest means, whether they are a younger person who has disabilities or who needs specific care for particular issues that they have. Everybody will be able to benefit from it. So it's right that we have a broad tax base to raise the money.
Right, but what is clear is that nobody will have to pay more than £86,000. What is clear is that you won't have to, if you've got a home that's £250,000, £250,000, you won't have to risk that. By the way, that's a lot more assets than a lot of people who'll be paying this tax will have. But what isn't clear is that this will in any way transform or even fix social care. There's money there, but you haven't said how you're going to do it, really. And the Institute for Fiscal Studies points out that there's every chance this will be gobbled up by the NHS. The money, you say, is hypothecated, but it's not hypothecated towards social care. It's hypothecated towards health and social care. So it's quite plausible by the NHS, simply by the cost inflation. The last party that did this, the Labour Party, found that half of the extra money raised by national insurance was gobbled up by simply pay inflation within the NHS and other forms of inflation. So there's no real guarantee that the care home system, which claimed, I think, a third of the COVID dead were passed away in care homes, a big problem there. We don't really have any idea how that's going to be fixed.
Well, certainly, there's a couple of points to make there. One is that health and social care are not sort of like two separate things. The point is that people who are finding themselves taking up hospital beds could much better, in many cases, be looked after at home. That was the case during COVID. It was the case before COVID. Lots of families who write to their MPs the whole time saying, I can't get any help at home for my mum. I don't want her to have to go in a care home and so on. So actually, you need to sort of, in a sense, look at the two in conjunction with each other. What you spend on your social care system will save the vast, vast sums of hospital beds. But in addition to that, the government's going to be bringing forward legislation to create a cap and a floor system for social care so that, in effect, it becomes inexorable that money will be brought into the social care system. It won't be able to simply be absorbed in the NHS to pay for the COVID backlog. But just to be clear, this is not something that's going to go away. There are 5 million people now waiting for procedures and operations as a direct result of COVID. That would rise to about 13 million by the end of this year if we did nothing. So actually, to do nothing isn't an option. So yes, of course, there's a lot to be worked out. In my view, I would like to see an insurance system for social care to top it up, for people to be able to insure their own assets and so on. But in the short term, we have to do something to deal with the COVID backlog and to sort out this social care system that's already broken.
Can you say a bit more about that insurance system? Lots of other countries do have that. It seems to be an option. Do you think there's potential to develop that?
Yeah, I do actually, and I was interested yesterday, the Prime Minister was saying there'll be a white paper about social care coming forward. I mean, I personally, having presided at DEFRA over the establishment of Floodry, which you might recall was when we had those terrible floods and people couldn't get flood insurance. So the government set up a quasi-private sector with government backing system for flood insurance, where every household of Band D council tax or higher had £10 a year paid out of their council tax into a pot that the government then added to enable the private sector to agree to insure households against floods. So that kind of socialising the system, but bringing in the private sector to actually be able to provide some backing for it. I think then you could have a system where people were paying insurance premiums, and potentially the older you are, the richer you are, the much greater your insurance premium would be, as is the case with private healthcare. So I think a mixture of state and private sector would be a good way to go. But I think what the government's done now is to get a grip on something that is already broken. So I think it's absolutely essential that we do that.
Right. What the government's done now, though, as you say, is give a lot of money to NHS with a huge backlog. But interesting that you're saying that insurance works for insurance works for floods. So why couldn't insurance work for long-term social care as it does in other countries? Could this be the trick the government has missed, or do you think there's still a potential to arrive at something like this before you get into the phase where the money is transferred from the NHS and goes towards the care home sector?
So I think that there's two aspects to this. One is we have a system that's broken right now. So we've got this huge backlog in the NHS. And we have a social care system where people can't get domiciliary care. The care home, the quality of care homes and the availability of care homes for people is simply not there. So we have a short-term problem that we really need to fix. And I do think that biting the bullet and facing up to the fact that it's breaking a manifesto promise and so on, people will be relieved that the government's getting a grip on it. However, in the longer term, I think people who say, well, how do we know that this is going to be sufficient, is a very valid question to ask. So yes, I would like to see us looking at a longer term Floodry style of national insurance scheme that people could buy into.
Andrea, thanks very much indeed. I'm now joined by Marcus Fysh, who's been one of the more outspoken rebels against what the Prime Minister's announced. Marcus, how would you describe the reaction amongst your fellow Tories to the fairly big announcement this week?
Well, I intend to keep my manifesto pledge to not increase these taxes that are proposed. National insurance, I think, is the wrong measure at the wrong time, and I think it hits the wrong people to be paying for something which we should be thinking of in a different way and funding a different way.
Right, you've been quite forthright in that you describe it as a socialist approach, a big mistake. It's you don't believe it's conservative. Can you say a bit more about that? What's unconservative about this?
Well, what's unconservative is to reach for tax levers at the first instance to pay for costs which are temporary on the economy in terms of the NHS recovery from COVID. And I think, tax and spend is what people would normally expect from the other side of the aisle rather than us.
But nobody expects a global pandemic, and you'll accept the costs of fixing the backlog aren't what any Tory could put in a normal gamut. Surely these are exceptional policies for exceptional times.
I think we should make a distinction between costs that are one-off, that are not going to recur because of the pandemic, and costs of the ongoing and recurring need to help our burgeoning older population with its health and social care needs. And I think it's been a bit disingenuous for the government to be mixing the two things up in the way that they are with this very broad-based and, in my view, it will become irreversible tax rise.
Now, Marcus, in the last few days I've spoken to quite a few Tory MPs who say what you say, but they're disturbed by this. Some say they're sickened and appalled at the idea of increasing the tax on somebody on the minimum wage to subsidise somebody with a £2 million house. The funny thing is that the Tories will complain about this, but they won't vote against it. Even you haven't voted against it. You've abstained. So why is it that so many of your colleagues, I'm sure you've had people saying to you, Marcus, I agree with what you're saying in public, but they themselves will not join you in public criticism? There's a sort of fatalism about this. I'm beginning to wonder if the Tory party is actually far less opposed to this than a lot of the backbenchers make out they are.
There is very broad unhappiness about what has been proposed and the way it's been proposed. I think people do think it's unfair broadly on the working age population to be taxed in this way and at risk to their jobs and their employers who are trying to get back on their feet after the pandemic. I think they think it's both politically risky and economically risky. But the reality is that we need to give the government space to be able to come forward with the full proposals and try to work with them to get the policies changed and improved. And that's why I think it's right not to have voted against the government at this stage, so that we can at least have a constructive conversation with them going forward and try to fix what I think is a misguided policy that's been done more for sort of PR reasons than for sound policy reasons.
But Boris Johnson seems to have certainly got a warm reaction to this. The opinion polls suggest that voters, certainly older voters, seem to think he's made a sensible decision. They recognise that in the pandemic taxes need to go up, and that a lot of people want the care homes fixed. I mean, when Theresa May came up with the idea of asking the wealthy to pay for the cost of their own care, the Tories got such a backlash that you guys lost your majority. So I put it to you that what you're proposing just simply isn't politically sellable now, given where the political power, electoral power, lies where it does, with older voters, because without older voters, the Tories would not be in power. So you guys basically work for them from now on.
I don't think that this plan will actually fix social care. I think it will make it worse. And I think the people I've talked to in the care sector and local government are extremely worried that in fact this tax rise money will just be taken by the NHS and it will disappear, they will never give it up, and in the meantime the industry has to cope with the changes that the government has announced to mean, for example, that care providers can't cross-subsidise their state-funded provision with the private care residents, and that means that many of them will be uneconomic. There'll be less capacity in the industry in the next 2 years, which will make it harder to fix the NHS with the discharge requirements that are there to get all the work and the backlog cleared. And I just think this is an absolute mess of a policy that hasn't been properly thought through, and I think it's basically a bit of a wheeze that someone has thought up to use what you mentioned, which is the very goodwill of the British people to want to help this system, which has clearly been overloaded with lots of demand because of the pandemic, and force through a tax rise, but call it something else, call it a goodwill payment to the NHS, which people like to say that they want more healthcare and they'll pay for it and all the rest of it, but face them with a tax rise that could interfere with the economic recovery, and let's see if they really want to pay for that.